Well, hey there, Dr. Andrew Gorecki, and in this video we're going to talk about what does your MRI or X-ray really mean as it relates to hip pain and hip diagnosing conditions. And so, the quick answer is it doesn't mean as much as you think it does. And so we have a lot of new evidence that's out there where people were given X-rays and MRIs when they had no pain in their hip at all, and the research is showing that a significant amount, so 69 to 73% of people that are pain-free, that are imaged, have some hip structural abnormality, most commonly referred to as a labral tear, which we'll get to as we talk more about the different types of hip diagnoses and pain. But you're finding this, so what that means, in the British Medical Journal, in a study recently, described it as many people with hip pain have arthritis, and many people without hip pain have arthritis. And so hip pain and arthritis are not directly linked together, meaning the arthritis is not the cause of the pain. And we're finding this throughout the entire body. If you look at the lumbar spine, the lower back, 80% of people that were imaged over 50 years old had disc degeneration, which is arthritis in the spine without any pain. Same thing in the neck, the shoulder, the knees. And so we're really finding that the imaging is really used to show aging in the body as well as historical damage. Can you think about if you've ever hit your fingernail with a hammer? And when you do that initially, it hurts pretty bad, right? And then a few days later, there's black and blue kind of bruising underneath the nail. Looks terrible. Excuse me. And then a month later, we have a nail that looks really bad. It looks black and blue still, and it might be kind of trying to fall off. And somebody might say, oh my gosh, that looks like it's really painful, but we know that it's not painful, right? It was painful a month ago, but it's not painful now. And so when you're looking at imaging, you're really looking at historical damage as well as aging. And it's not enough to be able to say, oh, you have arthritis in your hip, therefore that's the cause of your pain and we should replace the joint, right? Here's another one, asymptomatic imaging, 2,114 people without pain. 37% had a cam deformity, 67 had a pincer deformity, and 68 had a labral injury. So we really have to be careful. Our imaging is important. I describe imaging as a pre-surgical tool. If a surgeon's going to go into the joint, they really should see what it looks like before they go in there. That's not a bad idea. But in order for us to diagnose that and then let that help us with a solution to our problem, it's very limiting. And it actually is the gateway to surgery. So early imaging is a gateway to surgery. It doesn't mean as much as you think it should mean. And we want to try to use movement, and movement that causes pain, movement that turns off the pain, as really our guiding light.